All right, this is Josh Rubin from East West Healing and Performance. Today we're going to be talking about UTIs very briefly, just a natural way to eradicate them instead of going the antibiotic route. That's if you don't want to go the antibiotic route. Keep in mind, this is just to educate you. If you have a UTI, you should consult your doctor and find out your options from there. But UTIs can happen many ways. From my experience, clinical experience, more and more are coming in. It's through the National Institute of Kidney Diseases. They've shown that basically every year 8.3 million visits to the doctors are because of UTIs. So we've got to ask ourselves why. One of the reasons that I find is women that have fungal infections or reoccurring fungal infections or chronic fungal infections typically are more susceptible to UTIs or urinary tract infections. I find women that have bacterial infections, such as E. coli in the gut, sometimes not the bad E. coli that's going to kill you, but there's many strains of it, can actually crawl out down the anus and up outside the body to the urethra. So that can be one of the reasons. Another reason can be the chlamydia or mycoplasma bacteria in the vagina, given to them from a male, can actually cause a UTI. Same thing in a male. Males that have fungal infections, the chlamydia or the mycoplasma bacteria can give it to the female. And if you have a client or yourself and you have this reoccurring UTI, it's typically because the male is giving it to the female. That's very common. So the question is, if I'm going to get rid of it and it's reoccurring, am I just treating the cause, or am I treating the actual root, the effect of it all? If you just treat the effect, meaning you, and you're not treating the cause, meaning the male, you're going to keep getting it. So you might want to do some lab testing through your doctor, through biohealth diagnostics, through our company to find out what's going on. So you don't keep treating it and just keep treating it and perpetuating a vicious cycle of passing it back and forth. So what do we do for a UTI? Of course, if it's an STD or chlamydia, things like that, and mycoplasma, obviously we refer them out, but at the same time we do a lot at East West Healing to strengthen people's immune systems so they can possibly not go on prescription medications. It's basically their choice, though. We don't talk them out of it. At the same time, if we do test them and they do have E. coli, an easy way to actually eradicate this type of E. coli is with prebiotics and probiotics. If you go to our YouTube page or website or blog and you look up the replenish part of the 4R gut healing program, you'll see the prebiotic and probiotics that we use for a 2-month protocol. Third thing, if someone has an acute UTI, what we use is a product called UT Synergies from Designs for Health. And this actually has a lot of B vitamins and herbs and things that they're kind of grouped into one. But if you can't get UT Synergy, something good is actually called D-mannose. It's actually the sugar in cranberry juice. You don't want to do just straight cranberry juice. It's typically too sugary, which will feed the mycoplasma, which is fungus. At the same time, it makes you too acidic, it makes your reproductive organ fluids in the digestive system too acidic, which perpetuates the issue. So we typically get people on our HLC program from eating right to drinking enough water to getting enough rest, on and on and on. But we recommend what's called D-mannose, D-mannose. And what this is, it's one of the sugars in cranberry juice. It actually prevents the bacteria from adhering to the lining of the bladder, which causes the cystitis or the inflammation and the pain upon urination. So what it does when you take it 3 to 4 times a day, depending on the dosage, it's actually water soluble, so you actually excrete it very easily. That's why you have to take it 3 to 4 times a day. The bacteria will actually adhere to the D-mannose instead of to the lining of the wall, okay? And you'll urinate the D-mannose with the bacteria on it. So you got to make sure you're drinking plenty of water when you're taking the D-mannose. You can actually get it in powder form, which is great. Another thing you want to take with it, that's if you're not urinating enough or getting a complete urination, is a Western herb called uva ursi. That's UVA URSI. And that basically is very supportive and adaptogenic for the bladder and kidneys, and it actually helps to flush them out. Not excessively like a cleanse, it just helps to push fluid through the kidneys so nothing stays there and gets stagnant, which will help to actually prolong the cystitis, okay? So if you can't get the UT Synergy, we recommend the D-mannose or the drawing a blank. The D. mannose and the uva ursi. At the same time, you always want to make sure that you don't have the E. coli, or you don't have a fungal infection, or if you feel like you have chlamydia, which you would know that you do, you want to go see your doctor. But there's some natural ways to eradicate the bacterial infection from having a UTI. If you have any more questions, feel free to visit our website at eastwesthealing.com, our blog at blog.eastwesthealing.com, or give us a call to set up a free consult. Signing out for now, and I'll see you later.